Hey guys, back again. Well, it's been a whirlwind 2 weeks since I last had my arthroscopic shoulder surgery, and all I can say is it's been eye-opening. It's been up and down. I've been in absolute agony, practically rolling around on the floor when I tried to go off my pain meds the first time, all the way through to feeling quite normal and wanting to get back into everyday life. I've got my list here as usual of things to go through. So first thing I've got on here is that I had my dressings taken off a couple of days ago. My friend who is a community nurse, he just lives around the corner, so I was lucky enough he came and he did my dressing change sort of a week after the surgery, and he came and took them off the other day, and everything's looking fantastic. I'll let you guys have a little look here. I'm not sure how much you were able to see. Most of them, I've got 4 that are like these little tiny cat scratches along my arm. They're just still a little bit raised and a little bit sort of touched. I don't know if on the film you can actually just sort of see the bruising around. That's a little bit of that disgusting green bruising. And I've got one big one that goes across the top here. I'd say it's sort of a couple inches long. Let's have a look. There we go. A couple inches you can see compared to my finger. So to the first knuckle there. It's got a little bit of granulation tissue just on the tops and the bottom there. But other than that, healing really, really nicely. Let's have a look what else on my list. I've seen my physio a couple of times, I think 3 times now. I've got to go again tomorrow. And he's just been doing a lot of sort of relaxed manipulation. So basically asking me to just completely relax my arm, not utilize any of the muscles at all in my arm and my shoulder. And then he's doing things, I'll do it with my left arm to show you. He's just lots of circular motions and stuff. So he'll hold the top and support my arm, and he'll actually sort of really, really get that joint moving, complete 360 rotations. Getting me to do things sort of like crossing my arms across, lots of back twisting and stuff. Now, one thing I started the other day was actually shrugging my shoulders. So I don't know whether you guys can actually tell in the video. You can see my right shoulder's actually not able to shrug completely as much, but that's as to be expected. I mean, 2 weeks after surgery, considering I was told that I was going to be immobilized in a sling for 6 weeks, to be like moving like this 2 weeks later is absolutely fantastic. So he's got me doing things like forward shoulder rolls, backward shoulder rolls, lifting my arm up, like not using my right arm and actually using the left arm to grab that wrist and actually lift the entire weight of that arm up, as far as I can go without any pain. I suppose just to keep that arm moving, keep that joint moving. The last thing you want after any surgery is your actual joint locking up and not being able to move it, because it's like going to sleep for 12 hours and then waking up and you're all stiff and everything like that. Imagine that after shoulder surgery. It's not a nice feeling. The other day I took a sleeping tablet and ended up sleeping for probably about 13 or 14 hours, which is the first time I've done it while I had surgery, and it's the last time I'll do it because I was absolutely dead. I was sleeping in my recliner chair and I woke up, I had a sore back, I had a sore butt, sore shoulder, sore neck, everything. So I don't recommend taking sleeping tablets and unless you really, really have to. I, of course, had to because I wasn't sleeping for a couple of days. So I bombed out, had my 13, 14 hours sleep, and I'm okay again. What else have I got on here? I've gone off my painkillers now at 2 weeks. I was only on 2 paracetamol in the morning, 2 ibuprofen in the morning, and 1 tramadol in the morning, so bare minimum. Once my Celebrex ran out after the 7-day mark, I started taking the 2 ibuprofen. But as I normally say, like, you take your tablets sort of every 4 to 6 hours, depending on what medication it was. I was only taking them in the morning when I got up, especially because I planned all my physio appointments and things like that, all my shopping activities, everything like that in the morning. So I wanted those painkillers to hold me over first thing in the morning. And then I would take them again at night before I went to bed to help me sleep. So I'd have that huge gap sort of between, say lunchtime when they wore off to then taking them again at, 10, 11 o'clock at night when I went to bed. And I found that I wasn't doing all that bad. So despite having so much problems going off sort of a week after when I stopped my tramadol and being in excruciating pain, I've actually been okay. My arm today has been quite achy, but I figure that's normal. So I've just been using my wheatgrass bag, heating that, putting it on, laying down on the couch, sort of supporting it with a pillow. And just every time I sort of get up to go to the toilet or something like that, doing my, shrugging shoulder movements and things like that. And just not overusing that arm too much. It's a really fine line that only you will understand with your own body. Your pain, let your pain be your guide. And I suppose that's the main reason I wanted to try and go off the pain medication a bit earlier than I suppose the doctors have wanted me to, and that is because my thinking is pain medication is there to block the pain. I mean, that's ultimately what analgesia is. And if you've had shoulder surgery and you can't feel the pain that your body's going through, then you might end up injuring it even worse. And with me, I'm the kind of person who can't sit still. I can't relax, even for 5 minutes. I've got to always be doing something. So I think it's a good thing for me to not be completely numb with that arm, not to block too much of the pain. I mean, if it's getting excessive, I'm going to want to block some of that pain out so I can manage and sit still without screaming in pain. But I'm not going to want to block it so much that there's no pain there completely, because that pain is a reminder of me that, yes, I've had some sort of surgery done there. My arm is in pain. I'm not supposed to be moving it. I'm not supposed to be swinging above my head and lifting lots of heavy things. Which, I mean, I had lots of medication after both my cesareans with my kids. Within 5 days of coming home from hospital, I was lifting heavy washing baskets, hanging out washing. They say don't lift above your head. I was hanging up on my washing and things like that again, which you probably really, really shouldn't do. And I don't advise anybody doing it. As a person, as a nurse, I don't advise doing that. Do what the doctors tell you to do, otherwise you're going to hurt yourself even worse. But that's one of the reasons I've gone off the analgesia. And I think the 2-week point is a pretty good point for you to sort of play around with that, provided that your doctor's okay with it. And my physio has said, as long as I'm okay with that and I feel okay, trust my body. So that's what I'm going with. Sorry, that was a little bit long-winded, but I just wanted to sort of explain myself there. Also, don't take what the doctors tell you to take. Always question it and do what's right for your body. That's one of the biggest things I could say. If you've watched my first videos, you'll see I had a lot of problems with my pain and analgesia coming out of hospital. So go back and watch my first couple of videos, the post-op video in the hospital. Probably the ones, that one and the one straight after that. That'll give you an idea. What else have I got here? Okay, I've got my post-op surgeon appointment tomorrow. And basically, I have no idea what he's going to go through with me. Probably just a quick sort of 10-15 minute checkup just to make sure everything's okay and that the surgery went okay. And just to, I suppose, confirm that I'm on the right track and everything. Just cover, I suppose, all his bases and stuff like that. The last thing I'll talk about, so it's not such a long video, is returning to what nurses call and doctors call ADLs, which is your activities of daily living. Or your normal personal hygiene stuff, or the activities you do in your daily life. I'd like to say that I'm probably about 40 or 50% there at the moment. I can, even though I'm not supposed to, I can probably do them at a stretch, but I'll only do them if I feel comfortable and if I'm not having pain while doing them. So that's a big thing. Let the pain be your guide. So I haven't started brushing, I haven't started brushing my teeth yet with my right hand because I can't, I can get my hand up to my mouth, but that repeated action for 2 to 3 minutes would probably be a lot of strain. So I can do simple things like I can actually wash my face if I bend my head forward. So my arm's actually able to come up sort of to about there. It's not that it's painful. It's not painful at all. It's tight. I don't feel I have the strength to go any further than that. And that will come with time, that with the building up muscle, the physio and all the exercises the physio has given me to do at home, that in time that will come. I'm able to lift my hand out in front as well, sort of just almost to sort of flat level, just a little bit below that. Again, that feels tight, doesn't feel too painful. I can bend at the elbow, which I also encourage because you'll end up with frozen elbow. Your elbow will ache, it'll feel arthritic, it'll feel really, really tight. Whatever you do, whether you've got the sling on, whether you've got the sling off, always try and keep your elbow moving, and your hands. Try and keep your hands, I do this all the time. I've always got my hand, when I've got it in my sling, I should add, I also wear my sling when I go out in public, for 2 reasons. One, my arm just popped itself out there, sorry. It does that. Ligaments are still trying to get tight. Oh, there it goes again. All right, I'm going to stop moving that right arm now because I know it's not going to happen, but I'm freaked out that my arm's going to dislocate itself again. It keeps popping in and out. Sorry to digress. I do wear my sling when I go out in public, like I said, for 2 reasons. The first one is to give it the added support. And the second is to make sure that other people can see, hey, I've got a sling on, I've injured it. They don't have to know I had surgery. They could thought just sprain my shoulder, sprain my arm or something. But it'll keep people, hopefully keep people from bumping into it, keep people quite aware of it. Also get lots of help at the shopping centre and things like that when they go out and stuff like that. So it's kind of nice that people are considerate. Actually, a bit more considerate of a sling, funny enough, than a baby bump. So go figure. As far as, yeah, all the movements and stuff like that, I just keep my arm moving. I try and do what I can do. I'm able to sort of do breakfast in the morning. I can shower myself now. I've figured out ways to sort of, you know, dry my back by slinging the towel and sort of dragging it over my back, all that kind of boring stuff, or standing in front of the little heater. I can brush my hair sort of pretty much all this way, and then I might just get the other side to sort of help. I can't do my hair up yet. I'm still having to get people to put my clips up and stuff for me, so I'll wear it down pretty much most of the day. But yeah, dressing, I did the washing today. I put a load of washing on, sort of tried to hang it out. I folded laundry the other day. Sort of anything that I can do basically with my hands in front of me is okay. It does get exhausting, so after half an hour to an hour I have to actually stop and have a rest. But listen to your body. That's the biggest thing I can say as I finish this week's video up. Listen to your body. That's the biggest thing. Be it pain medication, be it feeling nauseous, be it your body's feeling sore and locking up. Listen to your body. I cannot stress that enough. If something feels wrong, question it. If you feel like you can do something, say to your physio, say to your GP or your surgeon, hey, is it okay if I can do this? I feel okay now. So I said to my physio, is it okay if I stop wearing my sling all the time at home? His answer was, as long as you feel okay. That simple as that. But just let any medical staff looking after you, any physicians you're seeing, or specialist services, let them know. Same as your medication. If you're going to go off any kind of medication, let them know. And then they can let you know. I mean, as a nurse, I already sort of, I've got a base knowledge. I research things. And then I can consult my knowledge with the medical specialist knowledge and then make an affirmative, informed decision. And I suppose that's the key thing, is an informed decision. And if you feel sore again, like I did, I stopped my tramadol, feel sore, I went back on it. There's no shame in that. I mean, we're not superheroes, we're not robots, we're only humans. So listen to your body and do what it tells you to do. All right, guys, I hope you're enjoying my videos. Leave your comments in the comment box below and I will get to them. And I've had quite good feedback on my videos already. People have been personal messaging me and things like that, asking about individual situations and stuff. So I'm going to keep these videos going. As I said, it's a 2-week mark now, so I don't know when the next one will be. It's whenever I get a chance at the moment, because I don't know if you can hear the kids playing the Wii in the background, but it's quite noisy in my house. So I had to steal a quick moment in the bedroom. So next video, hopefully in a week or so. But if you guys want me to do more frequent videos, drop me a message and I'll try and do some. But I'm happy to answer questions anytime. So thanks, guys. Progress is going good. It's been 2 weeks, so I'll see you guys in a couple of weeks, if not when I get back from London. All right, bye.